Hello, and welcome to the Pivot Pre-Op class. Today, we are going to discuss all of the details that you need to know to be ready for your upcoming procedure facility. We're going to discuss pre-op medications, what to expect when you are at the surgical facility, discharge instructions, operative visit with your surgeon. They will review your current medications and explain any changes that need to be made before your surgery. It is important to know that you can take pills after surgery. There is no need to crush or take liquid medications unless you feel like you need to. If you do feel like you're struggling to take medications in a pill form, please discuss with your surgeon or pharmacist because not all medications are able to be crushed or turned into liquid. It may be helpful to take one pill at a time to increase the tolerance after surgery, especially if you take a lot of medications. Consider spreading them out by taking one pill every 10 to 15 minutes with a small sip of water if needed to increase your tolerance to those medications. There are some medications that do need to be stopped or changed prior to your surgery. 2 weeks before surgery, you must stop taking any type of injectable GLP-1 agonist medication. Those are medications such as Ozempic, Trulicity, Victoza, Wegovy, Zepbound, or the generic forms of those that you may be getting from outside of a doctor's office. It's really important that you stop these so that your digestion returns to normal and doesn't cause any anesthesia-related complications. We also ask that you stop taking NSAIDs for 2 weeks after surgery. NSAIDs are a type of pain reliever such as ibuprofen, aspirin, Advil, Motrin, or Aleve. If you take these medications within the 2 weeks before surgery or any time after surgery, it can increase your risk of developing ulcers. So it is very important that you avoid these medications. You can take Tylenol for aches and pains if needed prior to surgery. We also ask that you stop all vitamin and mineral supplements in addition to any other supplements you may be taking. That does include prescription supplements such as iron or vitamin D. You may be able to continue taking thiamine supplementation depending on instructions from your dietitian. For patients that have diabetes, especially if you're on glucose lowering medications such as insulin, you may need to change your insulin dosage or your medication dosage overall. So be sure you discuss that with your surgeon and also follow up with your primary care doctor or your endocrinologist for additional guidance on how to manage those medications. When you start your pre-op diet, you're going to be eating much less carbohydrate, so you may not need as much of that glucose lowering medication, and we want to avoid hypoglycemia during that time. If you take any blood thinners on a daily basis, such as Plavix, aspirin, Coumadin, Xarelto, or Eliquis, changes may also need to be made to those blood thinning medications. So we will coordinate with your cardiologist or primary care doctor for those changes. But be sure you are telling your surgeon if you take these medications on a daily basis so we are aware and can make those changes to avoid any unexpected bleeding during surgery. At that pre-op visit with your doctor, you will also be given prescriptions for all of the medications you need for surgery. We really encourage you to pick these up as soon as possible. That way, if there are any issues obtaining these medications, if an authorization is needed, or if something is out of stock, we have the time to get that resolved for you. You will be given prescriptions for 2 medications that you will use before your surgery. One of those is a scopolamine patch, which is a little sticker, and you're going to place that behind your ear the night before surgery to help control nausea. Each patch lasts about 3 days. Typically, you're going to receive 3 patches, so you can replace those every 3 days if you need to. Something to note is that very common side effects of the scopolamine patch are dry mouth and blurry vision. So if you're experiencing those things and it's uncomfortable for you, simply remove the patch and those symptoms should resolve. You will have other anti-nausea medications that can be used to control your nausea if the patch does need to be removed. You will also get a prescription for a medication called Amend. Generic name is aprepitant. You may see either of these names on your medication bottle, so be sure you take note of both. You can take this medication 3 hours before your surgery to help prevent nausea. Other medications that you'll be prescribed for after surgery include high-dose Tylenol, which you can take around the clock for pain, oxycodone for more severe or breakthrough pain, Zofran to take as needed for any nausea after surgery. You will also be prescribed either Lovenox or Eliquis to take after surgery for a short period of time to help prevent blood clots, and gabapentin, which you'll take as instructed to also help with pain. Now, your surgeon may prescribe medication slightly differently based on your need. So again, just be sure to clarify with the office that you are receiving all of the medication specified for you for your upcoming procedure. Now we're going to move on to the preoperative instructions. It is incredibly important that you stop use of all nicotine products, including smoking, chewing, vaping, nicotine patches, or even nicotine gum that you may be using to reduce your smoking or vaping frequency. If you are positive for nicotine the day of surgery, the surgery will be canceled. So it's very important that you stop use of nicotine products at least 6 weeks before your bariatric surgery. You will receive a urine nicotine and urine pregnancy test for those that qualify for that upon arrival to the hospital facility. So be sure that you do not use the restroom without notifying the staff. If you get to the hospital or the surgery center and you need to use the restroom, that's fine, but be sure you let someone know so we can collect that urine sample. They will wait until you have to go again before moving forward with surgery. So it is important that we get that sample. And another thing is we want to be sure that you have your 2-week post-op visit scheduled with your surgeon before you go into surgery to ensure that we know we're going to be seeing you again and check up on things after your procedure is completed. When you are packing for surgery, be sure that you bring your insurance card and photo ID with you. If you're staying overnight at the hospital and you use a CPAP machine, be sure you bring the machine with you. Just like sleeping at home, they will expect you to use that machine to help with oxygenation overnight. Bring comfy clothes. You will be up and walking a lot as well. So if you want to bring like some house slippers or, some no skid slip-on shoes for your walks around the facility, you're welcome to do so. Again, if you're staying overnight at the hospital, you may want to bring just your basic daily personal hygiene products like your toothbrush or some deodorant or something of that nature. Don't need to pack for a long-term stay by any means. You're also welcome to bring comfort items such as your own pillow or maybe a fuzzy blanket to keep yourself comfortable during your stay at the hospital. The night before your surgery is when you will stop consuming liquids. So nothing to drink after midnight the night before your surgery. We also encourage you to shower with Hibiclens twice before surgery. Hibiclens is a special soap that is used to really thoroughly cleanse the skin and has been shown to reduce the onset of surgical site infections. So this is just an added layer of protection. You can find Hibiclens in the pharmacy department of any major grocery store or store chains such as Target or Walmart or Fry's. You can take a shower with Hibiclens the night before your surgery. Once you take that shower, put that scopolamine patch on behind your ear, and then be sure to wash your hands after you touch it so you don't touch your face and get that blurry vision that we talked about earlier. In the morning of surgery, you want to take your Amend, also called aprepitant, 3 hours before your surgery time. You can take that second Hibiclen shower from the neck down. That way you don't get your scopolamine patch wet. Take any other medications as prescribed by your doctor with a small sip of water. You may still need to take thyroid medicine or blood pressure medicine, for example. So follow your surgeon's instructions on that. But no other liquids other than the sips that are needed to take medication. You will then arrive 1 to 2 hours before your surgery time, depending on the type of surgery you're going to be having and where you're going to be having your surgery. For women who are still childbearing age, we strongly encourage you to have a pregnancy prevention plan in place. It is recommended to avoid pregnancy for at least 18 months after surgery, or at least until your weight loss has stabilized. Women and men both can experience increased fertility after surgery, even if you've been told that pregnancy may be difficult or not possible. So be sure you talk about this with your primary care doctor or your OBGYN. We are open to any and all prevention methods, but we do want to ensure that you have something in place to prevent a pregnancy within those first 18 months. On the day of your surgery, if you're having surgery at a hospital facility, you will arrive at the main entrance 2 hours before your surgery time. From there, you'll be taken to the pre-op area where they will review your medical history, start your IV, and review and sign all of your consent forms together. The surgeons, the anesthesiology providers, the OR nurses, and other operating room staff will be there to answer and ask a lot of questions. You will likely get asked similar questions multiple times, and that's a normal part of the checks and balances system for surgery to ensure your safety. It's not that we don't know what's going on, but we want to be sure we get the same answer every time. And if there is a question in those answers, we're going to verify again to be sure that every person is on the same page throughout the entire process of your procedure. Once you're taken to the operating room, surgery takes about an hour to an hour and a half most of the time. From there, you'll go to the recovery room, and you'll usually stay there for a few hours before they move you to the place where you will stay overnight or be discharged from. If you are having surgery at our surgery center in Tempe, you only need to arrive 1 hour before surgery time. The prep process and the length of surgery is all exactly the same. You will stay in the recovery room for 4 hours before you get sent home. And then we will expect you to come back the following day for a post-operative appointment. So if you have not yet, be sure that you're planning to have someone bring you back the day following your surgery for an appointment. So we always do bariatric surgery laparoscopically, meaning several small incisions around your abdomen, like the photo on the left-hand side of the screen. Your incisions may be in slightly different places than you see in this photo. It varies, again, based on the type of procedure and for each patient. But you will have several small incisions. You will not have a big open incision like the photo on the right-hand side. On the inner layers of your abdominal tissue, the surgeons will use some stitches to ensure that those close and heal well. So if you feel some pulling and tugging and kind of a pinching feeling after surgery for the first few weeks, that's normal. It's usually from those stitches. Those stitches dissolve over time. On the outside of your skin, they use basically skin super glue. It's called Dermabond typically, to close the outer layer of your skin. That is usually kind of a purplish color. It will start to peel off after several days. Please try your best not to tug at it, pull at it, pick at it, and let it just come off on its own naturally. It can happen that some people have a little bit of a skin reaction to that skin glue. So if you notice a rash or any swelling or itchiness around those incisions, give us a call. Typically, some topical cream and a Benadryl fixes that pretty quick, but we do want to be aware if you experience that. After surgery, we're very, very conscious of your pain and nausea, and we're going to do our best to manage both of those for you. If you're not familiar with surgery, we manage a pain scale or monitor a pain scale rather on a scale of 0 to 10. 10 meaning the worst possible pain you can imagine. If you're lucky, hopefully you don't know what that feels like. So it may be difficult for you to verbalize what you're feeling, but try your best to tell the nurses how you're feeling because we don't know. Everybody responds to discomfort differently. You will be uncomfortable after surgery. You may not get complete relief, but our goal is to keep that discomfort manageable so you can still get up and move around and function. Once you're able to, you'll take pain medicine by mouth, and then our goal is to keep that pain controlled with the oral pain medicine at home. For nausea, you have the Amend that you took 3 hours before surgery. You have the scopolamine patch that you put on prior to surgery. You received additional anti-nausea medicine during surgery, and you have Zofran to use at home. It is also important that you get up and walk for a few minutes every hour while you're awake after surgery. This is going to help with nausea and also alleviate any gas pressure or gas pain left over from surgery. That gas pressure, unfortunately, is not relieved with pain medicine. You kind of just have to wait it out, but the more you can get up and walk around, the faster that is going to feel better. Immediately after surgery, you'll start stage 1 of your diet, which is clear liquids. For pain control, you're going to have that Tylenol and oxycodone. In the hospital, they are going to have some stronger medications that can be used if needed as well, such as Dilaudid. For nausea control, you've got the Zofran in the patch. For blood clot prevention, you're either going to have the Lovenox or the Eliquis. You're also going to have some compression devices on your lower legs to help increase your circulation. We want you up and out of bed as much as you can be and walking often. The nurses will also instruct you on how to use an incentive spirometer, which is pictured on the slide here. This helps encourage really deep breathing to help reduce the risk of any respiratory side effects from surgery. Typically, the recommendation is to do 10 breaths every hour, or if you get home, once per TV commercial or once per Netflix ad. We want you up and walking as soon as possible. This is a really important part of your recovery. After surgery, as soon as you need to use the restroom with assistance from the nurses, you're going to be able to go on your own 2 feet. And we want you, again, up and walking as often as you can be while you're awake after surgery. The morning after your surgery, you're going to progress to stage 2 of the bariatric diet, which includes full liquids and protein shakes. You still need to be using that incentive spirometer, and you still need to be up and walking as often as you can be, whether you're in the hospital or you've returned home at that time. Once you do get home, it is important that you stay on top of your pain management. If you try to be a hero and let that pain get out of control, it's much harder to bring it back to a comfortable level again. So take that pain medication. We provide very low dose prescription pain medication because the Tylenol and everything really works very well. So most people really aren't having to use a lot of it, but it is there when you need it. Take that nausea medicine to keep yourself feeling good. Hydration is important, and you're not going to be drinking well if you're nauseous. Remember to walk. Remember to drink. You will have a lifting restriction. Please lift no more than 10 to 20 pounds. If you have kiddos at home or animals at home, they need to come to you rather than you lifting them up. This does include lots of pulling and tugging and stretching and twisting. Try to be careful, let those incisions heal and rest. As far as getting back to work, we usually really encourage 2 weeks off. And that's mostly because you're just going to feel kind of drained and worn out those first couple of weeks after surgery. It's very normal to feel that way. If you have a more active job, you're on your feet a lot, you have to lift a lot, you may need slightly more time. So just be sure to communicate with your surgeon, and your healing process will kind of dictate when it's safe for you to go back to work. Typically, you're allowed to shower the day after surgery. For some of our patients, they do have a surgical drain in place. If you have that drain, you do have to wait to shower until 24 hours after the drain is removed so that little hole can close. Remember to please not scrub or pick at your incisions. Some itching is normal, just like any other cut that is healing. Pat dry those incisions with a clean towel after you shower. You do not need to cover your incisions unless they've specifically told you that you should. After discharge, it's important that you do not drive while you're taking prescription pain medication. Remember, no lifting over 10 to 20 pounds, no strenuous activity or sexual activity for the first couple of weeks. Just let your body rest and heal. While we want you to be up and walking, please don't sign up for Zumba class the week after surgery. You're not quite ready for that yet. So just take your time, walk around a bit, keep your body moving, but nothing too crazy for the first few weeks. Be sure you're up and walking every hour while you're awake, again, to stimulate that circulation and prevent blood clots and also alleviate that gas pressure. It is important that you do not soak your incisions for about 4 weeks. So while you can shower, you cannot like soak in a bathtub or a hot tub or a swimming pool or a lake or an ocean or anything like that until the doctors have told you that it is okay. Remember not to take NSAIDs because that can increase your risk for ulcers. It's also important that you avoid oral steroids of any kind for the first several months after surgery. This can significantly delay the healing process and cause complications. Remember to avoid smoking or inhaling anything of any kind, and nicotine of all kinds does need to be avoided. Follow-up visits are usually 2 weeks after surgery with the surgeon and the dietitian. And we also encourage you to follow up with your primary care doctor and any specialists, especially if they're managing medications for you within the first 1 to 2 weeks as well. At least give them a phone call and touch base for that continuation of care. In the first couple stages of surgery, it is really important that you learn how to become a sipper. You want to sip on 1 to 2 ounces every 15 minutes until you're able to tolerate more. Your overall goal is 64 ounces of fluid a day. It may take you several days to achieve that goal, and that is okay. On stage 2, the morning after surgery, we're going to add those protein shakes back in. So then your goal is to, while increasing your fluid intake, also start increasing your tolerance of protein shakes and get up to 2 per day by the end of the stage 2 diet. You can use some small little 1 or 2 ounce cups to help you monitor your intake. Most of the facilities where you have surgery will also provide you with a fluid tracker so you can kind of track how many cups you're drinking every 15 minutes to be sure you're getting enough. This is an example of one of those fluid intake logs. If you're having surgery at a Dignity hospital, they will provide this to you in the hospital and encourage you to track your fluid intake, your walking, and your use of the incentive spirometer. If you're having surgery at the surgery center in Tempe, you're also going to get a tracking sheet. But in addition to water and walking, we also want you to track your vital signs every 4 hours while you're awake overnight. And they will actually provide you with a blood pressure cuff and an oxygen meter and a thermometer to take home with you overnight to monitor these things. And the nurses will instruct you and your family on that before you leave the facility. When it comes to vitamins after surgery, we usually recommend that you start those 2 weeks post-operatively. Everybody needs a bariatric multivitamin. Most people will need a bariatric multivitamin with iron, but especially if you've had a gastric bypass, you need a vitamin with iron in it. If you're having a switch or a more malabsorptive procedure, you're going to need a vitamin that's particularly high in the fat-soluble vitamins A, D, E, and K. Everybody also needs some supplemental calcium citrate, and then additional vitamins can be added only if needed, and you will be provided direction by the dietitians in regards to specifically what you need after surgery. It's important to keep it simple. You don't need a bunch of extra individual vitamins or supplements. Unless you have a deficiency in one of these areas, taking more is not going to help, and in fact can be harmful depending on what you're taking. So please just ask your dietitian before you order and before you start taking any vitamins that have not been recommended, because too much of certain things can be a bad thing. And we're happy to provide clarification on that. A question that we get a lot is regarding hair loss after surgery. Hair loss associated with bariatric surgery is caused by a phenomenon called telogen effluvium. And this is temporary hair loss when a large number of the hair follicles enter the resting phase. So while your hair is shedding, there isn't a whole lot growing back at the time. Causes of this include significant stress. It could be from emotional stress, physical or hormonal changes. It could be major life events like childbirth or surgery or a major illness. Some medications, such as chemotherapy or certain types of birth control, can be related to nutrition deficiency, and rapid weight loss is a major cause as well. So for our surgery patients, we're going through several of these kind of triggers for this condition, but it will get better over time. The symptoms people often experience are gradual thinning of your hair kind of all over the scalp, increased shedding, especially, if you're brushing it or washing it or styling it, you may notice more in the brush or more on your fingers. The hairs themselves may feel less dense or more fine and thin. And sometimes the scalp can feel a little bit tender. As far as treatment, there really isn't a whole lot we can do. Usually this does resolve on its own over 6 to 9 months. Be sure you're using gentle hair care products. Avoid super harsh treatment. Now is not the time to go try a new hairstyle. Get that done before surgery. Now is not the time to revisit a 1980s perm. Okay, save that for later. You can consider some over-the-counter hair growth supplements such as minoxidil. I have seen some studies where dermatologists say this can be helpful for this type of hair loss, but it's not a guarantee. Time is our best treatment, and it will return to normal, usually after 6 to 9 months after surgery. As far as nutritional complications, dehydration is definitely high risk. It is one of the number one reasons we see patients end up back at the emergency room. If you feel like you are not meeting your fluid goals, your first step is to reach out and call us sooner rather than later. A lot of times with a little bit of troubleshooting with the dietitians, we can get that intake up and avoid a trip to the ER and avoid IV fluids. But if you're super concerned and if you're just really feeling crummy, we want to be sure you're getting the care that you need. Constipation is another common thing we see after surgery, but it is really important to understand that a delay in a bowel movement is expected after surgery. It can take several days before having a bowel movement, and this is incredibly normal. Okay, you will have been through a 2-week liquid diet with very little intake. Your body is not making or producing very much waste in that period of time. You're undergoing surgery where we put your entire body to sleep, and it can take about 3 days for your bowels to completely reawaken after a surgical procedure. And then you're continuing a post-op liquid diet. So again, not a lot of intake, very little fiber, high protein, all of which can lead to slower moving bowels. So be sure that you're keeping that in mind. Expect a delay in that first bowel movement. When it does happen, it could be darker stool, it could be slightly liquid. There may be small amounts of blood, which is also very normal for the first time or two. If that continues after a few days after surgery, then we need to know about it. If you are not feeling symptoms of constipation, likely you are doing just fine. If you start to feel gurgly, if you start to feel pressure in your bottom, but nothing's happening, you can start using milk of magnesia every 8 hours until you have a bowel movement. You have to be very careful though, because we can tip the scale the other way and then have diarrhea. So really only use that if you absolutely need to. And finally, be sure that you follow up for success. Surgery is a blip in time compared to the rest of your life, and we want to help you and support you in using this tool in the best way that you can. So please come to those follow-up visits, attend our support groups that we offer, and please reach out and call anytime you need additional support and resources. We are always here to be a champion for you. Congratulations and good luck on your upcoming surgery. We're really looking forward to seeing your success in the future.